There's no clear relationship between the clinical frequency of a disease in practice and the number of exam questions you might see on that disease state. And what does this mean? It means that some zebras actually might be more prevalent on a test than they might be in clinical practice. And the reason is this. Again, it's very difficult for them to write a question, let's say, on congestive heart failure or even COPD. There's multiple presentations, and a lot of time the presentation might be the same as another disease state. They want something that's pretty concrete, that they're going to give you a question so that the answer can't be challenged very easily because that's the answer. So for example, in the example Dr. Diamond's given here, COPD versus SLE and sarcoidosis. Now, sarcoidosis is not seen very often. It's a common disease, but it's not very common, especially compared to COPD or, let's say, congestive heart failure. But sarcoidosis has some very specific symptoms, for example, perihilar lymphadenopathy on a chest film, etc. So because it has specific things, they like to use some of those as test questions. And again, the frequency of these type of disease states is going to be more on the test than it would be in clinical disease. So again, or clinical practice. So when we're talking about what you're going to use to prepare yourself for this exam, make sure you've got something that's pointing out to you what zebras are important to study versus what zebras might be a total waste of your study time.